So it's just a glimpse of the regenerative opportunity, that it's not just changing what's on our plate, eating more plants, thinking that's the end. This plate is very powerful, one of the most powerful forces on the planet, because collectively, 1 billion plates can change just about anything. So just a question for you all. As we think about what we put on our plate every single day, how many pounds of food does the average person eat in a year? Maybe you've never stopped to think about that. We go to the grocery store every day, we buy food, we cook food, we go out to eat, but every day we're buying and eating several pounds of food. So when the research was done, they found that the average person eats about 2,000 pounds of food per year. Now, that is the equivalent of this little Chevy Volt. So people are eating from bumper to bumper every single year, 2,000 pounds of food, 100 bites a day. And so when we think about the cumulative effect of those bites, that amount of food passing through our body on a daily basis, we can begin to appreciate the cumulative effect of that food on our body, how the components of that food, what it's made up of, what's included inside of the macronutrients, protein, fat, and carbohydrates, and how that makes a difference in the function of our bodies, in the health of our cells every single year. But we also have to begin to think about, and we'll talk through in this lecture, the impact of those 100 bites, 2,000 pounds on the food supply chain, on the environment, on the soil. It all has an impact. But because it has such a profound impact, and as we've seen negatively, it can have the same positive regenerative impact when we begin to change how we're making choices around those 100 bites or 2,000 pounds every year. And our food system has changed dramatically. This is from USDA data, which shows us that in 1909, the average person was eating 5 pounds of sugar sweeteners per year per person. 5 pounds. Today, it's about 140 pounds. And it's not that we're buying bags of sugar. It's because sugar is included in every food product today. We've gone from 4 pounds of oil to 74 pounds of oil per person per year. And one of the challenges is the calorie density of oil. Oil is 120 calories per tablespoon, or 4,000 calories per pound. And so as people are eating more oil, they're eating greater calorie density. As we see here, the average person's added 500 total calories to their diet. Those calories get stored as fat, which partially accounts for the rising obesity rates globally. We've dramatically increased the total meat consumption, more than 100 pounds, and added 14 pounds of fish. Overfishing fisheries in the oceans and depleting fisheries, and moving to farm-raised fish with all of the environmental impact of that. We've added 30 pounds of cheese. And imagine this, 53 gallons of soft drinks per person per year. That's the equivalent of about a bathtub and a half full of soft drinks. And somebody's drinking mine because I'm not drinking 53 gallons. So all of this, and this is not just in the United States, this is globally. This westernized dietary pattern, this westernized lifestyle has been exported all over the world. And it's led to this trend that the leading cause of disability and death globally is diet and non-communicable diseases. And we can see on the left here, the trend line for disability-adjusted life years is related to non-communicable diseases. We're actually winning the war against communicable diseases, but the non-communicable diseases, which are heart disease, diabetes, lifestyle-related diseases, are increasing and stealing quality of life from people. We also see the leading cause of death globally are non-communicable diseases, and by 2030, it's estimated that 3/4 of the world's population will die due to a non-communicable disease. Now we have to step back and kind of look at that through the lens and realize non-communicable diseases are largely preventable and in many cases reversible. So we could dramatically improve the quality of life of more than 3/4 of the world's population by simply changing what's on their plate. And again, this is data from JAMA, just showing in the red circle, highlighting the fact that number one cause of death and disability globally are dietary risks. This is excessive westernized dietary eating pattern. And what's amazing about this, these two statistics, is that in medical schools today, the average medical school student receives about 19 hours of nutritional education in their four-year degree. And that's largely, ICU and hospital nutrition. But it's quite a dichotomy to recognize that the leading cause of death and disability is diet, and leading cause of is diet. And in medical schools, the education is not built to address the leading cause of death and disability. So we're educating healthcare providers in a way that we're not addressing the leading cause of death and disability. It's quite shocking. So we can begin to see, in the remainder of this presentation, that the plate is at the center of this web of impact globally. Our individual cells down to the atomic level, as we'll talk about, and increasing out through our cellular function, through our biologic systems in our body, our DNA, our general disease protection throughout our bodies, our ability to show up as a human in our families and at work. It impacts work schedules. It impacts the health of companies financially, governments, hospitals, and it impacts as we go out in the food production, soil management, the biodiversity of life itself, forests that are cut down for food production. It impacts so many things. And it goes back to what people are choosing to put on their plates two to three times a day globally. And again, I think it highlights for all of us the exciting opportunity to regenerate every one of those systems as people begin making different choices about the food on their plate. And in healthcare, we see the evidence of this. This is a cartoon showing two people mopping up water, desperately trying to catch the puddle on the floor, when the solution is turning off the spigot, turning the handles to shut off the water. This is really what's happening in healthcare today. We are mopping up lifestyle diseases. The budget for healthcare is $4.7 trillion today. We're spending nearly 80% of that to manage lifestyle diseases, which are largely preventable and in many cases suspended and reversed through the right diet and lifestyle intervention. So if we simply change the way that we addressed healthcare by going back and turning off the handle, stopping the flow of lifestyle diseases by treating at the root, which is assisting people in making better healthy choices, growing food the right way, and using health coaches to assist patients in making a lifestyle choice, there would be more than enough money in the healthcare system to take care of everybody's healthcare needs. However, if we don't do that, the puddle on the floor is only going to get deeper, and we'll spend more and more time and effort trying to mop up this puddle. And Desmond Tutu said this: there comes a time when we need to stop pulling people out of the river and need to go upstream and find out why they're falling in. And that's the question that I asked many years ago. Why are people getting sick? Where did disease come from? And it leads us to upstream, to lifestyle, to determine and discover the source of disease and to learn that it's largely preventable. And so as we begin working backwards to find out the cause of disease, and we'll talk through many of these. We've talked about at the bottom down here that, largely the primary cause for disability and death is dietary choices. And as we go back upstream, we see diseases like heart disease. We learn that there's a physiologic deterioration. The body starts to break down, hardening of the arteries, insulin resistance. We then understand that there's a deeper level cellular disruption. The mechanism of insulin sensitivity, the locks are gummed up by fat, and inflammation disrupts insulin signaling. And then we learn that all of this goes back to lifestyle choices, what we're choosing to put in our mouth, how we're choosing to manage stress every single day. But if we ask the question, what's driving lifestyle choices, we learn that it's culture. Our culture changes and affects our choices, making it more difficult to make healthy choices. And in some cases, like the blue zones, really activating and creating a downhill effect in lifestyle choices where you almost don't have to think about it. And again, this is just from a study to highlight the same point that as we go backwards to lifestyle and choice of behaviors, we see that it's the living conditions that impact our lifestyle choices. In fact, the leading social determinant of health in many communities today is the zip code. It's not even the lifestyle choices, it's where they live, because where people live impacts their lifestyle choices. And where we live is ultimately determined by the culture that shapes those living conditions. And over the last 150 years, our culture has changed dramatically in the values for food, the understanding of healthy foods, how to prepare foods, sourcing of foods, the marketing of foods, all has changed. And so our culture is changing our living conditions, which has directly impacted the lifestyle choices of people, leading to this epidemic of lifestyle diseases that we see not only here in the United States, but globally. And any street, not only in America, but Riyadh, Saudi Arabia, Abu Dhabi, and Bangkok, Thailand, wherever you visit, this is what you see today. Ultra-processed food, fast food, becoming the norm for many people on a daily basis. So just a question, this is talk about zip code. If you think about your neighborhood, your community, and it's just, again, helping you think about how you can find better resources. What does your community look like? Do you have resources like farmers markets? Do you have friends, or do you have your own garden? Do you have a potluck community that you can join on a monthly basis to encounter friendly, happy people? We'll talk about more of that at the end. But again, instead of a negative slant on the unhealthy community resources, I just wanted to pause and give you a moment to think about the positive resources in your zip code, and maybe even how you can begin contributing to some of those positive elements in your own zip code. Because your zip code, the social communities do make a difference. I just wanted to highlight these studies from social communities. If you have a friend who becomes obese, your chances of becoming obese increase by 171%. Recent studies have shown that quitting spreads through social networks. If your significant other quits smoking, you have a 67% decreased risk of smoking. Lower BMIs if you have healthier friends. People inoculate their homes with their own microbiome. And they found that if you're lonely, not connected to a community, is the equivalent of 6 alcoholic beverages a day or 10 cigarettes. That's worse than the unhealthy food choices. So being connected in community has far-reaching health benefits. Really, this is about, reversing the course that we're on. There's a lot of talk about sustainability today. There's a lot of talk about disease management today. But we're rapidly reaching a tipping point in every area. Individuals are reaching a tipping point in their health. Obesity rates continue to go up. Disease rates continue to go up. We're seeing diseases at younger and younger ages. We see the financial implications in hospitals and communities. We have soil erosion globally. We have more contaminated food systems. We have environmental crises. And so we're way beyond the idea of management or sustainability. We have to find a pathway to reverse and regenerate. And I sincerely believe that pathway begins with what we put on our plate. So what I'd like to do for the next maybe 50 minutes is just take you on a short journey, looking at the kind of atomic biochemical level of how food interacts with our bodies, stepping up to the genetic, looking at epigenetics, then going out into the cell biology, then more into complex biologic systems in our body, the organ systems like the heart, understanding the microbiome, and then talking about agriculture and the environment. Food is incredibly powerful, and we often forget that when we eat food, within 4 to 6 hours, food is impacting our cellular physiology at the deepest levels. Here's an example. When we eat food, there are alterations at the genetic level, turning switches on and off that result in persistent inflammation throughout the body. The lifestyle choices that we make on a daily basis are actively turning on and turning off these epigenetic switches.